Very good evening to one and all in this Facebook Live session today evening. It's been a great pleasure in addressing this gathering. My name is Dr. Ashwin Karuppan. I'm a practicing internal medicine consultant and diabetologist in Gleneagle Global Hospital, and I also have my own medical center, which is called Tambram Medical Center. And probably today the topic is going to be diabetes, Ramadan, and COVID-19. So, as we all know, we live in a country of university in diversity, and then probably we are all brothers and sisters hand in hand, enjoying this a kind of summer. And right now, the most hardcore topic is COVID-19, and then at the same time, we are all under lockdown currently, and we are with our families. And I hope everyone are safe and secure in your house. So, coming to this time of Ramadan, where it is a holy month, where this fasting, or they call it Roza, during the holy month of Ramzan, is one of the 5 pillars of Islam. The month long, it starts by 29 to 30 days approximately, is an obligatory thing for all healthy Muslims to follow. And people who are mandatorily Muslims are expected to follow this. And then if you see that in some cases like chronic condition like diabetes, pregnant women, lactating mothers, children, a little bit smaller children, and all these people are given exemptions, including the elderly, for Ramadan. So coming to this, despite potential exemptions given to them, still people decide to fast because that is their religious faith. That is what is Islam all about. And we have so much attachment towards the religion that despite having a chronic condition, we are allowed to fast. And then probably people do not want to let go of this holy months, especially that during those times you have the most blessing, and it's one of the most blessed periods of the whole year. So coming into today's session, where we'll go quick run around the question and answer session, where we have questions regarding Ramadan and diabetes, what you should be doing, and a little bit of COVID-19. I don't want you to bore with a lot of COVID-19 because we know that starting from morning until night, since we are under lockdown, if you open the TV, television, WhatsApp, wherever you go, COVID-19 is there. I don't want to bug you much with that. A few questions. First, in general, is it safe for a person of diabetes to fast for Ramadan? Yes, it is of course safe. But if you have certain conditions or uncontrolled or you're in a high risk group, then probably you shouldn't be fasting. So what are the complications which can happen during your fasting? The first is hypoglycemia. If at all, since you're fasting for a long time, and if at all you take anything, you get dehydrated, which can lead to thrombosis. There be hypoglycemia, where your sugars can go really dangerously low and cause a stroke-like symptom, or even potentially very fatal. And then there is another set where people eat a lot during Ramzan to overcome the fasting period, and then they land up in hyperglycemia. So as you know, now the intermediate fasting is actually increasing. So there are potential studies which says that, and the researchers also say that you don't need to consume all the calories within the speculated time if you are going for a 12 hours or a 14 hours fast. So what you regularly take should be sufficient. So people tend to overeat and think that they are not up to the mark, or maybe like they are not having enough calories, and they tend to gulp around during this iftar time. And then coming to the point of dehydration, we all know that summer is high. There is a scorching heat around, and then summer is high for us, and dehydration is one of the biggest problem caused to thrombosis. The blood becomes much thicker and can lead to stroke, into a lot of other symptoms which you have to be. Coming last but not least, especially in type 1 diabetes, who are basically dependent only on insulin, they have diabetic ketoacidosis. That's a very dangerous situation and potentially need probably hospitalization. So therefore important that the decision about whether fast is made individually based on the consultation with your doctor or the healthcare provider. So it doesn't matter if you're going to be severely ill, and then if you don't fast, it really doesn't matter. Allah is going to punish you, and I think that God will be always with you with these things. So please don't risk your life to fast. So that is one. Then coming to the point of COVID-19, many people in many seminars ask me this question. Are people with diabetes more likely to COVID-19? What about people with diabetes who fast during Ramzan? See, there is no enough data which suggests, there is no researches which suggest that diabetes itself can cause COVID-19. COVID-19 is a contagious disease. It can spread from one person to other. It can come to me, it can come to you, it can to anyone if you are in a contact with the person already having the disease. This is then why we are in the lockdown, so that we avoid contact and social distancing with each other, so that we get during COVID-19 by roaming outside or by getting contaminated by ourselves. So there is no such thing called that diabetes are more prone for COVID-19. The risk is equally among anyone who can get COVID-19, especially if you are in touch with the person who is already having the contagious disease. And then similarly, during the fast, some people ask me that there are higher rates of infection and hospitalization. To the fact that if you see, fasting gives you a lot of immunity. They say that become more disciplined, your brains can work much faster, you have more energetics once you tend to fast. It is basically a cleaning process of your body where you have to be disciplined and all your areas of the body come under control. So this fast was introduced even in those days, and it was found to be highly beneficial. So despite fasting and despite having all this, still in this modern generation, we don't get to have the effects. That is one of the reasons, is because we do not follow the basic principles of fasting. But like, oh, we don't exercise, we don't do all of this. And that is one of the biggest reason why all these problems are happening. And that is why the fast is no longer becoming to be, instead of that, when you complete the fast, you tend to be more of a sober type. And it goes either to hypoglycemia, people who are well under control, or it actually goes for hyperglycemia and it is not adequately controlled, especially diabetes. So we will do that later, what to do. And then coming to the next question, do people have a high chance of experiencing serious complications during COVID-19? See, COVID-19 itself, so we all know that what it affects our lung, it produces dry cough. It can produce breathlessness. It can rapidly progress to breathlessness to an extent where you can get severely hospitalized. But you know what is happening currently is, like, people are projecting only the death rates. They are not projecting the cure rates. If you see the overall global population, in 97% of the population, or I would call it 99% of the population, including all the asymptomatic patients, are completely all right. That means the people who are affected, the death taking place is less than 1% of the population throughout the world who are affected. So what we are calculating right now is like 3.3%. Why? Because those are the tests which we perform, and from the test rates we are taking the mortality rates. But if you or me have COVID symptoms and we stay at 14 days and later with mild cough or cold, we never know that whether we had COVID or not, and those are where we transmit the disease, but we don't have the disease ourselves. So that is why the mortality rate is less than 1%. And during this time, I also want to stress you that diabetes kills around 10 million people. That means 10 lakh people yearly, which is much higher than the COVID-19 itself. So coming to the applications part, yes, if you are a diabetic, you get hospitalized for COVID-19, definitely there are chances that you can become sick. Why? We all know that diabetes itself is a disease where your immunity power goes down rapidly. Even for normal infections can become thrice or twice as much as impactive compared to the other people. So we do have the same amount of risk as a diabetic. If we do not, the same risk as if you have a heart problem, if you have a lung problem, or if you are old age, you have the same risk. When you have diabetes, you have additional risk. So we should be very careful with all all things, and probably we should never try to go out in the crowd and get infected. Especially elderly people, especially people who have uncontrolled diabetes, definitely stay home. So this is the question about COVID-19 having a serious complications, and can it be possible? So which group have the increased risk of fasting? So that is the next group. I told you high risk individuals. High risk, very high risk. How do you categorize them? You categorize them that those with persistently high sugars, even before Ramadan, they will have 400. They are at terrible risk. If you fast or if you go ahead and contract COVID-19, definitely it's going to be a very disastrous situation. So keeping your sugars under control is the ultimate goal. And people who have recently recovered from diabetic ketoacidosis, that means you have been in hospital, the treatment of high sugar, and recently in a few months you have been discharged, definitely don't fast. That is not going to give you much of benefit. And those with medical condition who have heart or kidney infections or who have kidney related diseases, especially chronic kidney disease where your creatinine is there or you're going into a kind of management. So and elderly patients with diabetes with generally very poor health, they eat only one idli or one chapati, something like that. Please don't fast. And then people have diarrhea and chronic disease and acute diarrheal diseases, vomiting and fever. Please do not fast. As I told you, God is merciful. Definitely, you're not going to be punished for not fast. These are holy months. We do understand, but your life is more important. God has given you this life to live healthy rather than going ahead and fasting at this high risk state. And then you'll also be putting yourself into problems, and you will also trouble the people around you who are fasting peacefully. So please do not do that. If you're a high risk individual, please resist from fasting. We can always feed poor, or we have other methods to get the God's blessing. So coming to the next, when do you fast? For example, you decided to fast. You're a normal healthy individual with a very good blood sugar and everything is controlled, and all of a sudden something goes for whatever may be the reason. First, whenever you check the sugars or you feel a little bit of low sugars, immediately go ahead, check sugars, and if it is 7 milligrams, recheck the blood sugar once again. And if it continues to be between 70 and 90, you are expected to take the fast immediately and have something before you go for hypoglycemia. So the blood glucose is higher than 300. This is when you go for a low sugar. The same way when you go for high sugar, where the blood sugars are higher than 300, you are not expected to fast because that can lead to diabetic ketoacidosis. Please make sure you break your fast and do something about it. Go to a doctor or maybe continue your insulin regular doses or any other medications which are supposed to be taken. Or any kind of dehydration or any other illnesses, as I told you, diarrhea, vomiting, fever, please do not fast. So coming to this thing of when to break the fast. So coming to diabetes, Ramzan and COVID-19, some practical guidelines I would like to know. So before you decide to fast, please consult your medical doctor and then probably do whatever is necessary and then get his advice on how you should be fasting, what you should be fasting, and which category of risk are you with. And if you're advised not to fast, please make sure that you don't fast. And the way you can check your blood sugars regularly. I expect you to check your blood sugar at least 3 to 4 times a day if your sugars are not under control and you're a very high risk candidate. So now the question is, when should I check my blood sugar? Usually we ask you to check the blood sugar at iftar, just before iftar, 2 hours after iftar, and then before your morning fast, and 2 hours after your morning fast, and once in the afternoon. So these are the times which we recommend for people to check your blood sugar, and any time whenever you feel palpitation or you have signs of dehydration, dry tongue, please do a sugar test and make sure you are not under low hypoglycemic status. Other people with low risk, you need not fast. And as I told you, your patterns are greatly changed during Ramzan and may affect your blood sugar drastically. Therefore, it is important for you to check your blood sugar levels regularly. And by checking your blood, definitely you are not breaking any fast. Coming to the medical during fasting. See, there are many medical mandates what we'll have to do, like having half of it, cut down on your insulin before your morning time fast, or then you take full dose during iftar. So all these advices will be given by your diabetologist or by a doctor of your regular doctor, whoever consult you. Because I don't want you to go and adjust your own medications, because that can lead to much more risk. So there are certain medicines also will be changed according to the patterns you eat, and there are safer medications which do not produce hypoglycemia but still continue to get your drugs. So please do consult your doctors on the medical management, and based on that, they will tell you whether to inject insulin or not. Some people ask me, if I check the blood sugar or if I inject insulin, I'm actually breaking my fast. You are not breaking your fast. This has been religiously addressed, that in the region, if you check your blood or if at all you take insulin, you are not breaking your fast. So don't it. So if you have to take insulin, please do not try to avoid, and then probably take adequate precautions taking the insulin. The question where I see a lot of people are asking right now in the screen is like exercise during Ramadan. See, performing light exercise, moderate exercise where you do not sweat, where you do not stress yourself, rigorous exercise where you do not do any rigorous exercise, definitely do an exercise. Usually you can do it after your iftar. Once you finish your iftar and your prayers, you can do. And during this time, I would also suggest that, like people, especially Muslims, they practice this a kind of form of exercise where they read the whole during this month. That is called Tarabi. So if at all you are a part of Tarabi, that also has to be taken as a form of exercise. So you know that the part of performing this is a great exercise, a great stretch exercise, and probably like it involves various positions, and this can also create a form of exercise where you become fit, healthy. So the exercise is actually inbuilt if you are going to perform a Tarabi. But if at all, if you are not doing it, you can always go for a mild walk. You can go for a walk, usually preferably after iftar. Do not go walk during your fast time, and make sure you're completely hydrated before. So these are the basic steps of exercise. So when the month of Ramzan ends, you see overeating is there, especially sweets. During when you celebrate, there is a lot of overeating of sweets. It's a celebration. Definitely, we do understand, but we would like to keep you very much under control, because over at any point of time is not good for health. Even if it is an occasion, please do make sure that you don't consume more of sweets, and consult your doctor and obtain guidance on changing back to the medicines where you were previously, and that can give a lot of benefit for you. And the dietary advice. During this dietary advice, I would like to give you some kind of divided calories, where you divide your calories between the suhoor and iftar. Because what happens is, like during iftar, you have a huge amount of meal, and then probably you consume all those calories in the night itself, and in the morning you consume less. So all this has to be avoided. It has to be split. And coming to balanced diet, it is always advised you take 40 to 50% of carbohydrates, 20 to 30% of protein, or less fat content than 35%. That means please do not take these, or do not take fried food, which is very dangerous. And I see in a lot of iftar party, bhajis and all these things make up for a lot of snacks items which are not beneficial. Instead of that, you can take fruits which salads which can actually have a lot of benefit in your constipation problems. Because of dehydration, you can also get constipated. So taking adequate fiber is really, really important during this time. So minimize that you take high rated fat like ghee, samosa and pakoras. All these things please avoid, and use small amount of cooking oil. Do not pour the oil. And like in mutton and all these stuffs, when you cook, especially during the iftar time, the oil is already floating over it. So make sure that you don't consume all of this fatty stuff, because it's going to take a lot of your energy and probably put your sugars under high control. And then you can take you have to take low glycemic index food and high fiber food, release of energy slowly, and then probably grains, beans, etc. All these are much helpful. And regarding to the water content, where I can see many people are asking about what I should do about the water content. Water content, you have to stay hydrated. Definitely, yes. And two main meals: drink adequate water and make sure you don't consume any Coca-Cola or any kind of particularly aerated beverages or caffeinated beverages, because that will make you feel more thirsty. And sugary drinks, they make you feel very thirsty. And we have all experienced this. If you take a juice, you will never feel satisfied and you'll always be thirsty. So make sure you drink a lot of water, as much as possible, 2 to 3 liters, because you have to consume for the whole day and not only during that period. So you should be very, very careful on that. And coming to the diet, a little bit of the diet, what all you can take. You can take salads, you can take fruits, you can take tea or coffee with skim milk, or a very little milk, or once or twice. And you can have buttermilks, you can have vegetarian clear soups instead of having a thick broth soup. And then probably you can take roasted namkins instead of fried ones, fried chips, nachos. All these things needs to be avoided. You can egg, boiled egg is much better than the fried and the omelette. Take a lot of sprouts, and at least take a lot of almonds and walnuts, and try to avoid cashew nuts and hazelnuts. Though it is in diet, since you consider it to be religious to open the fast with the dates, please go ahead, take 1 or 2 pieces, not more than that. That give you a lot of thing. When you come to your main course, you can take multigrain chapatis. Have a bowl of steamed rice. You can have breads. You can have wheat. You can have wheat related pastas, oats. You can have whole dals, green vegetables, and probably lean meat like chicken and fish is okay. Mutton, yes, of course, it's one of the favorite dish, but still better to avoid mutton and better to avoid fried fish or fried items and chicken. For that matter, anything fried, please try to avoid as much as possible. You can have tofu, soya. You can have a very healthy diet. And if people ask me that, what about the desserts? Yes, sugar-free custards you can have. You can have cut fruits. You can have sugar-free carrot kheer, or you can have fruit curd, or you can have rice 2 or 3 in a day. All these things are allowed. So I think that we have a safe way. See, I want everyone to understand here that diabetes is not a starvation diet. Many people ask me that not all of this, and still, what is the fun in having a religious thing, or having a party or an iftar? See, or iftar itself, or this fasting itself, is given to you for self-discipline. So that's what I at least get to know, that it's a self-discipline program which is religiously timed. And in this fasting time, it is not about the food. It is about praying for each and every one of you, people in your house, the people surrounding you, and for the unity of the world. So this is what this fasting is meant for, and to praise the Lord for all that He has given for us. So we do want you to enjoy this fasting months, but we also have to be very careful in trying to be a bit overeating, and then getting obese and not ourselves in the control. This 40 days shouldn't be a precursor for you to struggle later for the rest of the year. So these 40 days you should make very comfortable, you should make very disciplined and religious. At the same time, you have to diabetes. So in a nutshell, just to give a closing note and go in for some of the questions. So if you say stay home, please follow the general advices of COVID-19. The government is giving an excellent advice, and you know that we are actually flattening the curve. Flattening the curve means that we do not have much of cases, at least not to an extent of the Westerners. Yes, people ask me, are we protected from COVID, or do you think that COVID being a very aggressive disease is mild in our country? Yes, it is milder in our country. I think we have done a good job by staying at home. I know during this time, a lot of people migratory people, a lot of poor people are suffering, but still it is worth all that suffering, because life cannot be measured by the money you make. It is being measured by the good deeds and the way you live happily. So all these things has to be taken in mind. There is a difficulty for every, but it is going to be temporary. We are flattening we have done a very good job, especially when it's coming to COVID-19. And this is going to proceed for another few months until we find a vaccine. The vaccine is not going to come anytime sooner. People are speculating that it's going to come in September or in December. I would probably have the research thing done, and probably it should be there, because producing a vaccine is not an easy task. It has to be tested on a normal individual and then expose them to the virus. And if they contract virus and if they die because of that, it's going to be serious illness. So we should be very slow in administering a vaccine, because if it is going to be produced on a mass scale, it needs a lot of data. So for data can be collected only a period of time. It cannot be collected over a short week or months. So right now we pray that this COVID-19 is going to get better faster with all the blessings of the Almighty, and we all this soon hale and healthy. Coming to the regular medications, please do consult your doctors. Feel free to them in teleconsultation or over the phone. Please do not adjust your medicines. Do not adjust somebody else's medicines during at this time, because it can cause serious effects for them. So please consult your doctor over the phone, or consult a near doctor who is in your family or somebody, or you always take an advice during telemedicine. So regular adherence to your medications is very important. Do not skip your medications. Do not skip your heart medicines. No cholesterol medication, no heart medication, no skipping any of that. Everything has to be taken. Do not take excessive intake of food. Do not take glucose diet. Have a physical activity, which is a light exercise. Have plenty of water as much as possible. And if you have a water restriction, please be a little bit careful. And if you are on a diabetic, please ask your doctor whether you can change to a different tablet. So all these things are the doctor's job to be done before you go in for a fasting, but still there are plenty of time. So drink plenty of water, as I told you. Regularly monitor your blood sugar during fasting as well as in non-fasting. And if blood glucose is persistently high, stop fasting, drink plenty of water, and get yourself adjusted, and immediately consult a diabetic team. Thank you all for listening, and and I thank Speak Health for this opportunity. And I would be answering all of your questions. Even if you don't answer in this particular session, definitely I will try to comment. And if at all you want to connect with me, I am on Facebook, and it's Dr. Ashwin Karuppan. Please do connect with me, and I would be able to help you in assisting in whatever means possible during this time. And all your questions and queries are most welcome. And during this time, the instructions of it. Thank you and all. Happy. Some of the questions which we would like to go through is, some people have asked if there is any insulin adjustment has to be done. Yes, definitely insulin adjustment is needed. So that is why we want you to continue to address the queries. And some people have asked what kind of if a diabetic patient recovered from COVID needs to be taken. See, right now we don't know if it is going to get treated. So if at all, if it is getting reinfected, we should be a little bit concerned about it. We are not get reinfected, because data also suggests that COVID is going to come back. Means we are all talking about a second wave in China and in the US and the Europe. So we should be a little concerned about all of this. And then during COVID, it is advisable to be a vegetarian. Need not be a vegetarian, but only the thing is that if you are a non-vegetarian, please make sure you cook and regular food. Cook well. Cook. So that is more important. Do not take food. And those selling vegetables infected with coronavirus, that is the reason the government has told you be careful. Do not go out unless and until required. And those vegetables fruits are safe to eat? Yes, like when you come, you always wash the vegetables, put them in a seal pack, and then keep it inside. So how you escape from this? It is not that you cannot be eaten, it is just that you have to be much safer. That is why they stress upon washing your hands. So probably have a safe contamination, decontamination of the vegetables, wash it well, and then you can put it. And when you cook, and probably the virus is going to get killed anyway, because if you're going to boil, then boil for 1 minute, also the virus dies. So don't worry about all that. Have leafy vegetables, definitely yes. Please have a lot of leafy vegetables. Green leafy vegetables are much better than a starch related. Answered most of the questions, but you still have some questions we'll be able to answer. There is one more question which says how to avoid hypoglycemia during Ramzan by eating the right consumption of food, by adjusting your medicine to a particular extent where you do not go for low sugar. That's what I was telling you. People are asked to take full dose during iftar, and you take half the dose during Gur. So that is, and we all have avoid. There are also some medications which need to be changed. So there is one question which says that a patient with SGLT2 inhibitor advisable during Ramzan, and can it be continued? See, SGLT2 is a good drug. Definitely produces less of hypoglycemia compared to the other drugs in sulfonylureas. And the only problem is that since you don't drink adequate water, probably you get urinary tract related infection. So you should be a little bit concerned in using. If you are a very good candidate for SGLT2 inhibitor, especially young patients who have hydration, no other questions, yes, please go ahead and continue. It will help you in a long run. So it is advisable. So plasma therapy, the ongoing trials, even I am doing a trial on plasma therapy. The results will be out soon. So far, we do not have adequate donors for donating plasma, and do not have adequate numbers for them to prove those things, unlike in Westerners. But yes, plasma therapy is found to be effective. So we are trying to do whatever possible. So I believe that we have completed the Facebook session live of today in Speak Health. And as I told you, you can always connect me on Facebook, and you can go to my website www.ashwinkaruppan.com. Definitely we will answer all your questions, and if at all you require any help, please let us know. Thank you all. Jai Hind. Namaste.